Okay, so in my talk, I want to focus on what information do you need from a report. And I also want to tell you about how we look at reporting and reporting forms at LAREB. And I also want to discuss with you some new approaches that we are trying or that we are interested in trying in order to increase reporting. But the first question is, why do we need reports? Anyone? You all want reports. Why do we want reports? This is very concerning. So we talk about the form and everything, but why do we need to have these reports? Okay, I will continue to my next slide. One of the aims of pharmacovigilance is to try and find signals. And as you might know, a few years ago, we said that a new signal is a new association that was previously unknown. But in the recent years, the definition of a signal has been expanded to include much more than the new and unknown. And this is a more recent version which the EMA uses. So it still has the new potentially causal association, but also a new aspect of a known association. So that means really that the scope of pharmacovigilance is increasing. And if you want to capture these new things, you need to ask for it in your form. So you have the expansion with the type of products that you are looking at. You are looking at the traditional drugs, but more and more PV centers are also involved in vaccine vigilance. So you also look at vaccines. In some countries, the use of herbals is very widespread, so you might want to look at that as well. And some countries also have a lot of problems with the SSFFC, and it's the spurious, substandard, falsified, counterfeit drugs. We also look at ADRs, what we in the meaning of an ADR mean. We also look at medication errors that sometimes leads to ADRs. And we also look at overdose and abuse of drugs that leads to ADRs. So one of the questions that I have to you, if you want to find signals and your scope is this very broad spectrum in what you want to find, can you do a one-size-fits-all approach? Can you make a form that for a reporter will capture all the possible things that you would like to capture? I'm very interested to hear your thoughts about this.
Question is does one size fits all? My answer would be no. My first rationale would be because of each country's local differences. But what's important is the core information. So the core information, as long as the core information is there, is okay. But how it is formatted, how the questions are being presented would really depend on local differences. For each culture, we have different views in looking at specific questions. So it won't fit all the countries.
I think Bruce wanted to say something. No? Okay.
Maybe not when you're looking, having a paper form, but when you're in a web-based environment, you can easily lead people through the different things. You don't have to bother them with aspects they're don't interested in, and you don't interested in. So in a web-based or form, you have a lot of possibilities.
Yes. Okay. But in all those circumstances, also when you have a counterfeit drug and a medication error, you need to have some standard information. And the standard information sometimes is by legal requirement. A country says we need to have this information to call it a valid report. Some of the information that you will need it to do a good causality assessment to see is it really an ADR. And some of the information is needed to be able to contact the reporter and ask for follow-up information. When you look at most forms, almost all forms contain these four headings. You need to know something about the patient. You need to know something about the drug use. You need to know something about the event, and you need to know something about the reporter. So all reporting forms should contain these four elements. And I will show you in the next slides what kind of things you can consider. And I think the difficult things is to find a trade-off in what you really need to know in that specific case, because only then you can reduce the workload for the people filling it in. So what would you like to know about the patient? You have the very obvious one. You want to know the age and the gender to be able to assess, do I have a very old person, maybe with decreased renal function, which will affect how they react on a drug. Sometimes in some countries it would be interesting to know the ethnicity, although I know in some countries it would not be possible to ask for ethnicity in a reporting form. For example, in the US, they are very used to using the ethnicity. In the Netherlands, we would never ever be able to include that. Although you know that some polymorphisms and some susceptibility for certain events are based on ethnicity. And then you have the difficult one. You want to know something about the patient's medical history to be able to say something. Can the medical history influence the event? And here you can ask it very shortly, or you can ask it very in-depth. So I think that's a one that you have to do a trade-off. How much do you want to know? About the drug use, you want to know which drug is suspected to have caused the drug. You want to know the indication for that drug, maybe. To know, is it a confounding by indication? Is it really the disease that the patient is treated for that is causing the ADR? You might want to know the dosage to see if it's a normal dose or if it's an overdose or something. And you might want to know what they have done with the suspect drug. Did they continue? Did they taper off? Did they stop the drug? Sometimes it's interesting to see the concomitant medication to be able to look for interactions. And if you cannot get the medical history of the patient, sometimes the concomitant medication can give you an indication about the comorbidity of a patient. You also might want to know if the ADR has been treated with other drugs. Because if you want to see, do I have a D-challenge? And a D-challenge is different if you only withdraw the suspect drug and you do nothing and the event disappears. But if you withdraw the drug, you treat the patient and the patient recovers, then you don't really know if it was stopping the suspect drug or by treating the ADR. So that can also give you quite a lot of information. And by knowing how the ADR was treated, you can also look at, you can get a picture of the severity. If someone said, I have had an anaphylactic reaction and I didn't get any treatment, well, real anaphylactic reactions are quite deadly, so most probably you will get treated. So that can be sort of starting point to know if the diagnosis or the event that was reported also was true. About the event, you want to know the type of the event. Was it headache? Was it an anaphylactic reaction? Was it a Stevens-Johnson syndrome? You want to know when it started, because together with the start date of the drug, you can calculate the latency. You want to know if it stopped, for example, after stopping the drug. You want to know if it was treatment, both drug treatment or other kinds of treatments. And you also want to know during which circumstances this event occurred, because maybe then you can detect medication errors. Misschien then you can detect that it was a counterfeit drug and that sort of things. So that would also be interesting and to know all these aspects. Since we're a bit short of time, I will proceed. I will talk about now the situation in the Netherlands, and I'm aware of that your setting is very different from yours, some of yours, but I hope some of the concepts that I give to you can be useful for you for the implementation in your countries. I wanted to start to show you what kind of reporters do we have at LAREB. And as you see, patients are the main source of reporters at our center. Pharmacists are reporting quite good. Also medical specialists, general practitioners is not reporting very well at the moment. And hospital pharmacists and other healthcare professionals are increasing. And then you might think, why is this so strange that this goes up so from nothing? That was the year when we became responsible for the vaccine reports. So these are reported by that. But as you see, it's challenging to keep getting reports. So you need to have a very attractive reporting form so that the reporters will continue to report to you. Because without reports, you cannot do any signal detection. So how do the reporters report to LAREB? I'm very happy to hear that you have been using the LAREB form in the course, but I'm sorry to say that we have almost abandoned the paper form. It is not actively distributed anymore. And as you see here, 94% of of all the reports that we receive in a year is through our web-based application. And only 6% is paper. And not all of these 6% is the paper form, because a very easy way for a medical specialist to report to us is to send in a copy of the discharge letter in the hospital. So if he has documented the ADR in the discharge letter, by sending us an anonymous copy of that report, you will have all the information that you need about the event without the physician having to fill in the form. So that can also be a tip, that you can make use of already existing documentation instead of having the doctors and the pharmacists fill in a new form. And for vaccines, we also have the possibility to report through a web form. So what do you need to think about when you develop a form? I think it's very important that you as PV professionals decide over the content. What do we need to know in order to make a good causality, in order to have a report to be valuable for signal detection? But just as we are experts in the field of causality assessment, I also think it's important to involve the right people with the right expertise that can make it a good form for you, the layout. Because if you are a scientist, a pharmacist, or a doctor, doesn't mean that you're also an expert in how to design a form or how to make something attractive to you. So I think it's important to let people do what they're good in. So I think developing a form should also be a collaboration between different professionals. If you are aiming for a web form, you have the design, how it looks, but you also have the functionality, how does it work? So you would probably also need IT professionals there to help you develop a good web form. And I just want to give you a short look on this is how our form for the web form looks like. So here you can see we have a few. Oh, I don't know what happened there. Here you can see that we have the ADR, the drug, the patient, and the reporter. And under there you can fill in the ADR. You have information buttons. Stars are mandatory fields. And you also have from free text fields and drop-down fields. When you develop the form, the need from the National Center must be leading. But if I would develop the ideal form, which I would be the most happy with, then no one would fill it in, because it would be too big for anyone, because I would like to know everything. So you really need to try and look at how can I make a user-friendly report? How can I make it attractive and easy for the reporter to fill it in? And thereafter, when you have decided on that and you have start building your reporting form or designing your reporting form, it's always good to have it tested by people who are not so involved with you. Because in countries where you have patient reporting, you need to understand that your report must be readable and understandable to people of all levels of education. If you only accept healthcare professional reports, you have a higher level of education. But if you also have patient reports, it must be understandable and fillable for the whole population in your country. And that's a challenge. And I also think, just as Will said, when you get feedback from your reporters, when you get feedback from people, then you need to have a sort of continuous improvement. So a form is never finished. It's finished for the moment, but when you finish, you should start a new circle and looking, how can I improve it? And depending on your resources, that can be once a year, maybe once every 2 years. But I think it's important to remember that things develop so fast nowadays. So you should always look with a critical eye on your pharmacy. Is it still up to date? Does it still fulfill the needs of how people do work? Because we have a web-based form and it works excellent on computers. But a few weeks ago we discovered that most people don't use the computers to fill in a form anymore. They use their tablets. And then we had a system that didn't work very well on tablets. So then we would have to think again, well, how can we do this so this also works on tablets? So you need to follow the developments on that in that area. We have moved from paper form to web-based forms, and that has a reason. And what are then the advantages as we see it for web-based forms? It's easy access. You don't have to distribute the form to all of the reporters. What you have to distribute is that people know where to find the form on your website. And indeed, it should be very easily accessible on the website. You should see directly when you go to a center, this is where I report. It's also quite cheap. You don't have to pay for the printing. You don't have to pay for the distribution. You have to pay for the development, which might be more expensive. And I don't know how it is with all forms. Our form is linked to our database. So when people fill in the information in the web form, it is automatically imported into our database. So then you can skip the step of manual data entry. If you have paper forms, you must have someone that can enter the information from the paper form to the database. You have a more structured data collection. If you have a paper form, even though people say you have to fill in this and this, people can still choose only to fill in one form, and then you have a form with no information, which you can do almost nothing with. By adding mandatory fields in a web-based form, you can structure your data collection, so your data quality will increase. So you will have more information that will make it easier for you to make a good assessment. And you can also have fast information exchange with the reporter. If you need follow-up information, you can mail them and ask, well, you submitted this report, can you help me get more information? So it's easier to interact with the reporter. What complaints do we get? This always has been and will always be. So what kind of solutions can you think about when people are complaining it takes more time? At LAREB, we are using more than one form. In fact, we have 4 forms. We have 2 forms for drugs and 2 forms for vaccines. And the difference between the patient and the healthcare professional is mainly in the wording, but the type of information that we collect is different. Why do we have 2 kinds of forms? It's because you want to know different things. But also in drugs, we don't really know which drug they want to report on, so I cannot make a report for drug A and drug B and drug C. For vaccines, for example, in the National Immunization Program, we have a set program that says with 1 month you get this vaccine, 2 months. So then we can ask, how old was the child? was it the first or second vaccination? So then they don't really need to fill in the drugs, the vaccines that were given, because we know if it was the second vaccination in the national immunization program, we know what kind of information it was. For example, with the drugs, we have open text files because we don't know which drugs they use, so we cannot know what kind of ADRs they want to report. With vaccines, we know that they always report on vaccines, and then we also know what type of ADRs often occur with vaccines. So then we have tick boxes. Did you get fever? Yes. And if they get fever, we ask specific questions about the fever. So that's the difference. So here you can customize your report so you don't get unnecessary questions which will cost extra time. Just as Nadia also showed, you can use with conditional questions in web form. So for example, if someone says, my ADR led to hospitalization, if you tick that, then you can ask question about the hospitalization, for how many days, what was the reason for hospitalization, what was the treatment received. If they don't tick that box, you don't need to ask those questions. So conditional questions can help you customize the reporting form for a certain type of event or a certain type of reporting. You can also use attachments. I think 1.5 years ago we started with the possibility that they could add attachments to their electronic form. And a colleague of mine has just done a small inventarization, and it shows that quite a lot of reporters uses the opportunity to attach something. And that can be, for example, a discharge letter, but it can also be the medication history from a pharmacy. So instead of typing 10 concomitant medications themselves, they just add an attachment and then we will add it for them. All kinds of information. But what is also very valuable for us and which is possible with this is that you also add photos. So for example, you can have a fantastic description of a rash, but by seeing the photo, you really know what they mean. So by adding attachments, you can make it easier to report. The burden is less by the reporter, but you can also get information, for example, photos that you can never capture in wording. What we are busy with now is to try to link to other electronic systems, because we know filling in a form is cost time and it's not linked to the information that they are already collecting about the patient. So for example, we would like to link to pharmaco records or GP records, because then the GP can choose, I want to report, and then all the data about the patient which is available in his system will be extracted to the reporting form, and then he can add more specific information. So you don't have a duplication of work, you use what it is, and then you can supplement it if it's not possible. So I think that is, at least for us, would be a very good way to get more reports and more high quality reports. What we are also thinking about is some sort of two-step reporting, that you have a very, very short form, much shorter than we have seen today. And when they send it in, you have a sort of fast assessment to see, is this interesting or not? And if it's interesting, you can do a more extensive follow-up. So that might be something. Also touched upon today is the social media. I don't know, this is the EMI project is a public-private collaboration, and they want to use new technology for pharmacovigilance. So one of the aims of this project is to develop an app for reporting of ADRs, but also using social media for data mining. So maybe in the future, reports sent to a PV center will not be necessary anymore, because we can do data mining on social media data. Who knows? I think I'm out of time now, so please, if you want to look at our form, unfortunately only in Dutch, please look at our website, and if you have any additional questions, you are very welcome to contact me.